taking prednisone can give you a 2 times greater risk of this vital deficiency. What is it? I'm Dr. Megan, the prednisone pharmacist, and I wanted you to know about this because it is important that you replenish this, or you can be at risk of permanent, irreversible side effects. So what is this deficiency? Well, I got this specific statistic from the National Institutes of Health in their health professional description of the nutrient vitamin D. This is specifically what they cited from a study. They said, and I'm just going to read it, in the NHANES survey, vitamin D deficiency was more than twice as common among children and adults who reported oral steroid use. So what that means is you are more than 2 times as likely to have low vitamin D while taking prednisone than people with your same disease who aren't taking prednisone or other steroids. And so it's really important to replenish this. Why? Vitamin D is crucial for many important parts of your body. For prednisone specifically, there are 2 things that I'm personally concerned about. First is your bones. Prednisone is impairing your ability to absorb vitamin D properly, which means your calcium isn't going to your bones, and the whole bone remodeling system is messed up. That means you're experiencing bone loss if you're taking prednisone. This is so important that the doctors who prescribe prednisone the most created a guideline all about how doctors should deal with this specific side effect. They call it glucocorticoid-induced osteoporosis. Try to say that 10 times fast. And this is what the American College of Rheumatology specifically says about vitamin D. Serum vitamin D levels should be monitored and vitamin D supplemented to maintain serum vitamin D levels of greater than 30 to 50 nanograms per deciliter. They want you to have your blood checked. They are specifically saying you need to make sure that your vitamin D level isn't low because it's so important to maintaining good bone health. Next, they recommend 600 to 800 international units a day to be supplemented. Finally, they recommend lifestyle modifications. 5 lifestyle modifications recommended by the rheumatologists to prevent osteoporosis. First, quit smoking. Second, limiting alcohol to less than 2 servings a day. 3, eating a balanced diet. 4, maintaining weight in the normal range. Now that's not as easy as it sounds, right? Because prednisone causes weight gain more than any other drug. And 5, performing weight-bearing or resistance training exercises. So that's what they recommend in addition to keeping vitamin D in the healthy range to prevent osteoporosis from prednisone. And I promised 2 reasons we're concerned about low vitamin D. The first was bones. The second is the immune system. It's tricky because prednisone is often used for its effect on the immune system. So you don't want to mess up what prednisone is doing, in my case, helping counteract the autoimmune attacks my body was experiencing. And so you need to keep vitamin D in the normal range so that you still have the ability to fight off infections. Plus, vitamin D itself can help reduce inflammation. Keeping a healthy vitamin D level is important for having a healthy mood and fighting off depression and anxiety. And this is especially important in the dark time of year, fall and winter, when the sun sinks lower in the sky. And so you can't get vitamin D the best way possible, which is through sunlight. In certain parts of the northern hemisphere, it's actually impossible to get vitamin D for months at a time. The closer to the equator you are, the more likely you are to be able to get vitamin D from sunlight. But otherwise, there are months when you cannot get it in this natural, healthy way. So you have no choice while taking prednisone but to supplement vitamin D. And I have some great supplement options for you. And in fact, I also can provide a vitamin D test that I recommend. So if you'd like to know precisely what vitamin D I recommend, because there are some you shouldn't take, and where to find a great vitamin D test that you can do at home, just click the link below and I'll send you straight to my best resources. Signing off is Dr. Megan, your prednisone pharmacist.